All right, Colin, thanks. 647, wearing red for women. It's all about sending a strong message today. Wearing the color red is a reminder that heart disease is not just a man's disease. February is American Heart Month, and Carolina the Morning's Lindsay Curtin live right now from New Hanover Regional Medical Center. She's got some signs and symptoms that all women need to be aware of. Lindsay.
Good morning, Bob. Yeah, it's always alarming to hear that heart disease is the #1 killer of men and women. So we're here at New Hanover Regional Medical Center putting information out there in honor of Heart Month. Just new information you might have never heard of. I'm here with the cardiologist William Smith, Dr. William Smith, and he's talking to us about arrhythmias, essentially irregular heartbeats. And I wanted to ask you, Dr. Smith, what are some symptoms of an arrhythmia? A lot of focus is on heart attacks, but what are symptoms of arrhythmias?
Arrhythmias are actually very, very common, as well as heart attacks. And many people might feel palpitations or the sensation of an irregular heartbeat. They might be lightheaded. They might be short of breath. It might limit what kind of activity or exercise they can do. In severe cases, people can pass out, and in certain cases, arrhythmias can even be fatal or life-threatening.
So on that note, scary note, there is some new technology out there. We're going to show you this live, actually. Some new technology out there that can really help people suffering from arrhythmias.
Well, one of the most common arrhythmias that we see is a specific arrhythmia called atrial fibrillation, which is very common. About 10% of men age 65 and 5% of women, and up to 20% of people age 80 have this. So it's significant, particularly as our population ages. And we've developed some new ways to treat it. Mainstay has been blood thinning and medicines. This device here is called a balloon cryoablation system. Wow. This is a way that we can sort of surgically or minimally invasively treat an arrhythmia inside the heart. And this contraption right here can be threaded through a vein in a patient's leg up to the heart. This balloon here can inflate. We put it in an area when someone has atrial fibrillation, when there's an appropriate candidate. We put this balloon into the area where the arrhythmia is arising from. We can map it with this little device here. We can map that the arrhythmia is coming from there, and then we freeze this balloon. And just like freezing a wart or a growth on the skin, believe it or not, on the inside of the heart, we can freeze where an arrhythmia is coming, and we can eliminate it or cure it in many cases.
Fantastic. That's great to see all this new technology. Dr. Smith and you guys are making great strides in the medical field to really help people and get that information out there during National Heart Month. We're going to send it back to you in the studio.
All right, Lindsay.